Hello, I'm Jim Thomas, an epidemiologist and ethicist with the Gilling School of Global Public Health at the University of North Carolina. I'm going to talk with you here about the difference between medical ethics and public health ethics. I'm standing in the quad of the University of North Carolina. At one end of the quad is the South Building, or the administration building, which you see behind me here. In the summer of 2020, the chancellor and the provost, who was charged with managing the COVID pandemic and whose offices are in South Building, were debating whether to bring all the students back to campus in the fall or to have them taught remotely. They consulted with medical faculty, they consulted with the local Board of Health and the health department, and then decided that they would indeed bring the students back. There were objections voiced by students, staff, and faculty, and even the county health department sent a letter to the chancellor saying they thought it was a bad idea. But they held their ground, and the administration required that students return. This would bring tens of thousands of students together on this one campus and the risk of transmission. As people feared, when they first arrived, within days of arrival, there were outbreaks among the students. And then there was another outbreak and another outbreak. And it was just a week later that the chancellor acknowledged what was happening and sent the students back home to then take their courses remotely. When the provost met with an executive faculty committee after the students were sent home, he refused to apologize for the debacle and declared instead that he was doing his best in a complex situation. However, his unwillingness to respond to the concerns of the faculty, staff, and students when they were required to come to campus resulted in distrust of the administration. Trust is perhaps the most important currency in public health. Public health programs and policies cannot succeed without the cooperation of the public. A lack of trust undermines that cooperation. Well, what would have been a better path to follow? One that would engender more trust. When we ask the question of what should happen, we have entered into the realm of ethics. While generally speaking, morals are what we are taught by our parents, friends, and our culture, ethics are systems of principles. They are the way that morals are formalized and institutionalized. In the realm of health, medical ethics have been established for the longest period of time and are the most familiar. Let's see what medical ethics has to offer for the guidance in the situation of COVID and the University of North Carolina. Professional ethics addresses ethical dilemmas that arise in common situations in that particular profession. It usually comes about because there is a power imbalance of some sort. Because where there is great power, where one person or one group has greater power than others, there is the risk, the opportunity for that group to abuse that power, to use the advantage of their position. In medicine, the common situation is a clinic room such as this one here. When the physician or the nurse or some other clinician walks into this room, they come with signs of power, like a white coat or a stethoscope around their shoulders. This room is theirs. This is their turf. And on the other side of the door, there are other staff who can come in to help if need be. There might be a diploma on the wall as a sign of authority. They will have a license to poke and to prod and to prescribe medications that can restore life or, if done poorly, could harm life. The patient, on the other hand, does not own this room. This is not their turf. It's a foreign place to them. They may be asked to disrobe, to perhaps take a medication that they don't understand, or they will be listening to a vocabulary describing medications, describing procedures that they don't understand. So medical ethics is designed to protect the vulnerable person, the person with less power in that situation. One of the principles of medical ethics is respect for the autonomy of the patient. That is, for example, the right of the patient to refuse a prescription or to refuse a procedure that is recommended by the physician. They should not be forced or should not feel forced into any kind of action or behavior. So, medical ethics then is responding to the vulnerability of the patient in a common situation within the medical setting. Here we see the principles of medical ethics on the website of the American Medical Association. The preamble notes explicitly that the medical profession has developed their statement primarily for the benefit of the patient. And then among the 9 principles, a clear example of this point is the 4th, which reads, "A physician shall respect the rights of patients, colleagues, and other health professionals, and shall safeguard patient confidences and privacy within the constraints of the law." The other ethical principles address the competence of physicians, their professionalism, and access to medical care. There is little here, however, to guide a chancellor and a provost in deciding whether to bring students to campus in the midst of a pandemic. The 7th principle mentions public health, but only in saying that a physician shall recognize their responsibility to participate in activities contributing to it. That leaves a lot of room for interpretation. The medical ethics principles then are specific to the patient-physician relationship, but vague about the conduct of public health. In contrast to medical ethics, public health ethics addresses the power imbalance between a board of health and a population. It addresses this with principles for carrying out public health that include accountability, transparency, and inclusivity. The power imbalance in public health isn't made in a clinic room between a physician and a patient. It's made in a room like this. This is where the Board of Health meets for Orange County. Orange County is the county where University of North Carolina resides. It's where also I reside. My home is here, and decisions made in this room affect me personally. The board is 11 people who make decisions for 150,000 people. So that's where the power imbalance lies, the ability for a small group to make decisions affecting such a large group of people. Because of that risk, there are some protections, some steps put in place. One of them is keeping the board diverse so it represents a number of perspectives from throughout the county. In addition to that diversity, there is transparency, an ability to look in on that decision-making process. Right now, I'm speaking to you in days of COVID, and there is an ability to participate through Zoom to watch these meetings. At other times, there are these chairs behind me, these blue chairs, where people from the public can come and listen in on the decision-making process. So there are steps to see what is going on, to watch the process, to make sure that the decision-making process is done ethically and the decisions themselves are ethical decisions. And in this way, these steps protect against abuses of power and guard the ethical implementation of public health. The Code of Ethics for Public Health is found on the website of the American Public Health Association. Instead of principles, they list core values, of which there are 6, labeled A through F. Value D is the interdependence of people. The explanation says that the health of every individual is linked to the health of every other individual. This is perhaps seen most clearly with infectious diseases, where one person's infection is another person's exposure. This interdependence sometimes means that one person's autonomy needs to be temporarily constrained for the good of the community. For example, a person infected by a respiratory virus may need to be isolated until their infection has passed. Public health ethics doesn't deny the value of autonomy. It's preserved in another value related to human rights, but it balances individual rights with the value of interdependence. Another value in the Public Health Code of Ethics is inclusivity and engagement. The Orange County Board of Health is honoring this value, which implies transparency and accountability,
by having meetings open to the public. And it honors inclusivity by having a board that represents diverse perspectives. These measures may not result in decisions that please everyone, but everyone will be able to see how the decisions were made and whether their concerns were considered. Inclusivity and engagement then enhance public trust in the health department. The initial decisions of the UNC administration were not made through processes that were inclusive or transparent. That alone undermined the trust in those decisions. The outbreaks that occurred immediately after students returned to campus, showing their decisions to be ill-advised, made that distrust even greater. To restore trust, the administration formed a campus and community advisory group that represented various perspectives among students, staff, faculty, and the community at large. The meetings were held online and were open to the public, bringing transparency to their processes. They also posted online recommendations to the campus administration with the aim of simultaneously protecting the safety of people on campus and the community and ensuring quality education for the students. From this example, we can see that medical ethics addresses concerns arising from the power imbalance in the clinic room, but it doesn't provide much guidance for public health. Public health ethics is much more attuned to the dynamics between a population and decision makers and provides more helpful guidance. Thank you for listening to one of my talks on public health ethics. If you want to learn more, you can visit the resources page on my personal website, jcthomas.org.